Good afternoon, everyone, and welcome to the Association of Maternal and Child Health Programs webinar, Breastfeeding in the Affordable Care Act. My name is Megan Philippi, and I'm a Program Associate for the Women's and Infant Health team at AMCHP. Before I get into the specifics of our agenda, I do have a few housekeeping reminders. Audio is available through your computer speakers. If you're having any technical difficulties with your audio, please use the chat feature on the webinar interface, and an AMCHP staff member will be able to assist you. We do have some time at the end of the presentation for question and answer. Please feel free to submit your questions through the chat box located on the left-hand side of the screen. And please address the chairperson with your questions, and be sure to include the presenter or presenters to whom you're addressing your question. Today's webinar will be recorded, and the recording will be available on AMCHP's website within a week after the broadcast. Following today's webinar, there will be a link for you to complete a short survey to give us some feedback about our performance and how we can better serve you with our future e-learning events. The objectives for today's hour-long broadcast will be to provide states with tools and resources to assist with the development of benchmarks and benefits for breastfeeding and lactation and consulting services, provide tools for outreach to businesses for the compliance with the new federal law to create breastfeeding accommodations for nursing moms, and feature state examples from New York and Nebraska. We have a talented group of speakers with us today, and so I'm now going to go ahead and turn it over to Carolyn McCoy from AMCHP, who will provide you with an overview of our recently released issue brief.
Hi, good afternoon, everyone. Thank you so much for joining this webinar. And since time is tight and I would love to turn it over as quickly as possible to our presenters, I just wanted to take a quick opportunity to highlight an issue brief that AMCHP is happy to release today called State Opportunities and Strategies for Breastfeeding Promotion through the Affordable Care Act. It's available on the AMCHP website through our National Center for Health Reform Implementation. And as you may know, the National Center for Health Reform Implementation provides assistance to states, MCH programs, and their key partners in CHIP, such as Medicaid and CHIP programs, to optimize the opportunities presented by health reform for women, children, and children including those with special health care needs and their families. Our work is organized around the four following cross-cutting themes: expanding access to preventive and primary health care, advancing quality maternal and child health programs, promoting service delivery integration between public and private systems, improving healthcare quality and health outcomes. And we do this through online resources, technical assistance, and consultation with AMCHP members. Our National Center and Health Policy team can provide you with resources that you need to help understand the impact of the Affordable Care Act and implement key MCH provisions. So with that quick overview of the National Center, a little bit about the issue brief, and I actually will just provide a tiny little bit about what the issue brief covers, because we're really fortunate to have two of the states that we've highlighted in the issue brief, plus a major contributor with the United States Breastfeeding Coalition on this webinar, or committee, I'm sorry. And they will be providing examples on how they've moved the provisions in the Affordable Care Act forward, both through the workplace accommodations and the home visiting programs, as well as the breastfeeding supports for women that were provided in the ACA. So without further ado, I'm going to hand it back to Megan. And thank you all again for attending, and please look for the issue brief on our National Center for Health Reform Implementation website.
Thank you so much, Carolyn. I'm now going to turn it over to our funder, Patrick Simpson from the W.K. Kellogg Foundation, to provide an overview of the Foundation's work around birth outcomes and breastfeeding.
Thank you, Megan. On behalf of the W.K. Kellogg Foundation, I want to thank and acknowledge AMCHP for the work that they did, not just in breastfeeding, but in the larger maternal and child health programming that the Kellogg Foundation supported. The mission of the Kellogg Foundation is to support children, families, and communities as they strengthen and create conditions that propel vulnerable children to achieve success as individuals and contributors to the larger community and society. We do this through a whole child development approach where we focus on programming related to educated kids, secure families, and healthy kids with a specific lens to community and civic engagement and racial equity. Our investments in maternal and child health, we fund both research and innovation that supports children and mothers across the continuum of maternal and child health. And within that, we fund specifically in first foods, for which my colleague Deanna DeReje is going to talk about the Foundation's focus on breastfeeding and first food.
Thank you, Patrick. As we look at how we at the Foundation look at our work, we have the Healthy Child Continuum, which is healthy birth outcomes, access to food, first food and support, parental and familial bonding, parent engagement, and social cohesion. And at the center of that is our work with holistic child development. In first food, we know that breastfeeding rates, there is a high disparity in initiation, 6 months, and 6 months exclusivity. And part of our work to establish health equity and racial equity is to focus on reducing those disparities. We know that for mothers and infants there are many benefits to breastfeeding. It has an infant's risk of ear infections, eczema, obesity, childhood leukemia, and necrotizing enterocolitis. And for mothers, reduced risk of high blood pressure, heart attacks, type 2 diabetes, ovarian cancer, and breast cancer. So understanding all that, for the W.K. Kellogg Foundation, our first food grant-making portfolio exists of expanded community supports for mothers and families in order to support them to make the best choices for their families, improve hospital and workplace environments to make breastfeeding easier, encourage new social norms and behaviors around breastfeeding, and strengthen the network of groups working together to increase breastfeeding rates.
Okay, thank you so much, Patrick and Deanna. I will now turn it over to Beverly Curtis, who will provide an overview of Women's Preventive Services regulation and implementation of the model policy.
Thank you very much. It's a pleasure to be here today. Today we're going to talk a little bit about the Affordable Care Act and some work that United States Breastfeeding Committee has done with, in collaboration with the National Breastfeeding Center. I actually represent both groups, in that I'm Chair-elect of the United States Breastfeeding Committee and Executive Director of the National Breastfeeding Center. When we talk about the Affordable Care Act with the new rules and coverage that the Affordable Care Act has put forth regarding coverage of breastfeeding services and counseling, there has been created a sea of confusion among the insurers in that there was a lack of clear directives for coverage and a lack of knowledge about the type of service and equipment necessary for breastfeeding help for mothers in this nation. The United States Breastfeeding Committee, along with the National Breastfeeding Center, worked together in a collaborative effort to help clarify these directives somewhat. For payers, mostly their decision to cover these efforts are made on economics and a lack of understanding regarding what mothers need. So the law states that payers must cover at no cost to the patient a comprehensive lactation support and counseling, but who provides the comprehensive lactation support and who are trained providers? And these are areas that were unclear to payers. A lot of payers had variations in their pump policies prior to the Affordable Care Act, and some of them have continued to have these variations, and others just chose to cover pumps regarding if there was a medical necessity. Some chose to provide the pumps with the least amount of cost to them, which would have been manual pumps. Some provide with from durable medical equipment providers, that's what DME is, and others you only use their in-network providers. So there's lots and lots of variations in the plans prior to the Affordable Care Act, and lots of variations since the Affordable Care Act came into being. I won't read every detail on every slide since time is limited today, but you can see that some of the options that are variations just in the pump policies themselves. The real confusion came as well with recognized service providers. Most insurers, and this is commercial insurance companies that we're discussing, not government insurance companies. So with commercial payers, they recognize physicians, nurse practitioners, physician assistants, those that are licensed and tend to be have licensed by an independent certifying board. Because there are the typical lactation care providers who are IBCLCs or CLCs are not already within network providers, this provided another difficulty for coverage in general. So as we move forward here, we'll see that the services provided were for counseling only, and then services separate from well visits, for instance, or visits, preventive visits for mothers. Okay, as you see here, these are some codes that are used for billing purposes, and if you're not familiar with billing codes, it gets fairly complicated regarding what codes to use and what codes are acceptable for commercial insurers. The problem is that many lactation care providers are not recognized as in the pocket of providers for a specific insurer. So you have to get in the network, so to speak. You need a National Provider Identification Number, an NPI number, to bill. And then even with that, you may not be accepted as a provider with insurers if you were providing lactation services of some sort. So what happened was that we collaborated together, the United States Breastfeeding Committee and the National Breastfeeding Center, to develop a model policy that would educate the providers as well as clarify what needed to be in the policy itself. And it has comprehensive billing codes in that policy as well as guidance for coverage criteria, types of providers, and what's necessary for equipment and counseling. The model policy focuses on helps the payers, the insurers, identify what's necessary to provide appropriate care for breastfeeding mothers. So this is a model policy for insurance companies. It's not necessarily for insurers that are government insurers or for Medicaid. It's just for commercial providers. It also identifies that payers can not open their networks to all comers, but they have specific criteria that all insurers use, and it's an effort to help identify and move lactation care providers into those networks. It also does identify ways that others can be paid through acceptable standards in insurance industry. So we discuss how others who are non-licensed providers possibly could be reimbursed through other ways, including Incident to billing as an employee or an independent consultant who works under a licensed provider. The model policy is available on the USBC website as well as the National Breastfeeding website. Our interest is to get the model policy in front of payers, politicians, and policymakers in your state. It can be used to be what it is, a model for care for breastfeeding services, and so can be discussed with your state insurance people who are your state insurance gurus, so to speak, and you can take it as a guide as you have those conversations with your state insurers. Another thing that the National Breastfeeding Center is using the policy for is to rank insurers. So we are taking insurance company policies and ranking them against the model policy and giving them A's, B's, C's, D's as their policy is compared to the model policy. This has created a lot of conversation regarding what private insurers are doing and has helped some come in more alignment with what appropriate care is for mothers and infants. We released one ranking in September of 2013. Our next ranking will be published in January of this coming year, and we'll see how insurers have changed their rankings in the last several months. And we'll continue to do that through the National Breastfeeding Center as we collaborate and have conversations with individual insurers. Thank you.
Thank you so much, Beverly. I'm now going to turn it over to Debbie Gregg from New York, who will discuss New York State Plan amendments. Debbie?
Thank you very much. Hi, everybody. I'm going to talk a little bit about the process for changing the New York State Medicaid benefit. Things started in January of 2011 when Governor Andrew Cuomo established the Medicaid redesign team by executive order, and this was the first of its kind in New York State to look at Medicaid benefits. The goal was to reinvent Medicaid benefits to improve population health and provide more cost-effective care. And the basic benefits work group was the one that researched lactation counseling services, and proposals were invited from the Department of Health, organizations, stakeholders, and the public. And the proposals needed to include the evidence base, also needed to include recommendations from professional organizations such as the AAP, the ACOG, and the American Academy of Family Physician policies that provided support for breastfeeding education and counseling, and then also estimated costs for healthcare savings. We looked at economic studies, and the Office of Public Health estimated cost savings realized from breastfeeding at around $532 per infant per year due to lower incidences of the treatment for otitis media, gastroenteritis, and necrotizing enterocolitis. I'm trying to forward the slide. Okay. The Medicaid Redesign Team Phase 2 Basic Benefit Review Work Group held public meetings, took statements from experts and stakeholders, discussed the benefit, and finally voted to add breastfeeding education and lactation counseling as a new benefit. New York State and Medicaid, where Medicaid is part of the Department of Health, staff worked together to develop a state plan amendment, and the plan was submitted to CMS June of 2012, and it was approved the end of December in 2012. New York State worked with Medicaid to develop specifics for the benefit before it was submitted as a state plan. Okay, the implementation date then for Medicaid fee-for-service was April 1st, and a month later for managed care and family health plus plans that the benefit would cover pregnant and postpartum women. And the first proposal that went through, and finally the last amendment that was actually approved, IBCLCs who are licensed and currently registered in the state of New York as a physician assistant, nurse, midwife, nurse practitioner, or registered nurse can provide services and be reimbursed, and that the services can be provided in a Article 28 clinic, private practice, freestanding clinic, or in a federally qualified health center. This benefit covers outpatient lactation counseling services and not inpatient services. This benefit is considered to be a distinct and separate billable service which acknowledges IBCLCs as providers. And you can see the billing services and the codes that are used for general patient education and individual sessions are $45 per session, and some of the other details are there. And for group sessions, $15 per person per sessions. And for both individual and group sessions, they're allowed during pregnancy and during the postpartum period. Okay. Most women in New York State participate, who are in Medicaid, participate in managed care plans, not fee-for-service. And these plans must provide the lactation counseling services, but the pay structure is up to the discretion of the managed care organization. That the plans are expected to reimburse IBCLC licensed and registered healthcare professionals for breastfeeding education and lactation counseling. Thus, managed care plans must use the patient education codes and provide the services as described on the previous slide. However, their payment schedules may vary based on the plan. Okay, I want to quickly talk about breast pumps, because as part of this initiative we decided to go ahead and look at breast pump coverage. Medicaid, as everybody knows, covers the purchase of manual and personal use breast pumps and the rental of hospital-grade pumps. But in order to improve quality in the state of New York, in the summer of 2012, we did a lot of research, and we conducted that research on manual and personal use electric pumps on the market, focusing on cost and the features of each pump, and safety was a consideration, especially suction pressure and variable cycling. What we did is looked at the minimum pump specifications which were developed, and we used as a basis the Western States Contract Alliance specifications, which are used in at least 32 states and tribal organizations. We also looked at specifications that were used by state WIC agencies across the United States. And as of April 1st, we also then implemented reimbursement for pumps that meet the minimum specifications. Just to give you a quick idea, breast pump coverage in New York after the research, the manual coverage went from $17.31 up to $31.71. The personal use coverage went from $40.63 to $173.47. So this fourfold increase really is to help get good quality personal electric pumps out there to mothers on Medicaid. Okay, I'd like to compare our policy with USBC recommendations, and I've already gone over that our definitions for the IBCLC healthcare professionals, and that we cover manual as well as personal use electric pumps and kits and the purchase of those, and then the rental of hospital-grade pumps and kits, but we do not cover donor milk. And then contrast that with the recommendations. You'll see that that IBCLCs are one of the providers that are considered to be lactation care providers with certification meeting recognized credentialing standards. It differs from ours. And also the recommendations did not address manual pumps, but they did address the coverage of donor human milk. And you look at what we cover versus the recommendations, you'll see that we cover one group prenatal class and postpartum class, and in contrast to one prenatal class and just support groups for up to 12 months. That inpatient coverage is, for Medicaid is part of the bundled services, and this depends on providing inpatient service when it comes to different providers that are private insurance. And also 3 outpatient visits with minimums time periods for New York State, and then comparison with the recommendations is 6 outpatient visits are covered as the recommendation. So just to share with you, the materials that are listed on these websites have been shared with probably at least 20 to 30 healthcare organizations in New York State and across the United States. And this includes breastfeeding coordinators from WIC agencies across the United States, as well as concerned coordinators and staff that work as part of coalitions. We've also done some webinars on this coverage. And so, what is our next steps? In spring 2014, we plan to evaluate the use of this benefit, the number of individual and group sessions that have been billed over this past year, and the number of breast pumps distributed to postpartum women who have been enrolled in Medicaid. And we've got some baseline figures from when we started, and then now we'll have new breast pump numbers to see what the differences are in the state of New York. And thank you very much.
Thank you so much, Debbie. I'm now going to turn it over to Amelia Pismythe from USBC, who will discuss the changes in the federal law regarding breastfeeding accommodation.
Hello, thank you so much. This is a very nice panel to be part of, and I see that we're clicking along right on time, which is great. I'm sure, like many of you, it was really nice to hear Debbie's highlights from New York. I think that when we look at the Affordable Care Act in total, the opportunity that the President is really asking us to embrace is how do we look at the system as it is with insurance and the medical model and combine that with the best of what the public health model has to offer. And so it's really great to see how different states have taken up that opportunity and what's possible in terms of implementation. So thanks again, Debbie, for the example from New York. I'm going to be speaking today about the Break Time for Nursing Mothers Law. This is a federal law that was passed, that became effective in March of 2010. So I think, or 2010, I think that many of us are familiar with it since it's been a while since it came out. But to cover the highlights, the law states that employers must provide reasonable break time and private non-bathroom space for hourly paid workers to express breast milk during the workday. So as you can well imagine, the terms reasonable and non-bathroom space are both a bit ambiguous. The law also goes on to state that the space should be free from intrusion from coworkers and the public. So that language is really nice because it allows for flexibility and adaptability to make the accommodations within a whole host of workspaces. But it also means that employers and employees need help thinking about what the creative solutions in their worksite could be. So the presentation that's following mine is going to be lifting up highlights from Nebraska, showing some of the ways that they are promoting the law and assisting with implementation. And I'm sure you all have examples from your states as well. So when we look at the official resources that are available about this law, in addition to the statutory language, there is an associated Department of Labor frequently asked questions sheet, as well as a fact sheet from the Department of Labor, fact sheet number 73. We also have a business case for breastfeeding from HRSA, and although that is a bit old, there's still a lot of very relevant information available within that guide, within that toolkit, particularly a section for mothers and information for them about storing their milk and talking to their employers, in addition to some of the ways to look at a workplace with flexibility in mind. So I was asked today to speak a little bit to the implementation challenges. By far, I think one of the biggest challenges is that the media has consistently misstated that employers under 50 do not have to comply with the law, and that is not true. All employers need to comply with the law and provide these accommodations to their hourly workers. It's just that those under 50 have the possibility of appealing for undue hardship if they can prove significant expense and difficulty implementing the law within their site for a given employee. We'll speak a little bit more about this in a moment. We also find that mothers and employers are still hearing and learning about the law, even though it's been a while since it went live. So this means that on every level we need to continue with promotion and support for workplace accommodations. We also find that there are common questions that are not addressed in the official sources of information that I just referenced. So again, we all need to be, that puts a lot of onus on breastfeeding advocates to be stepping up and helping employers and employees in figuring out how to meet the threshold of accommodation as articulated in the law. And then of course, we just have the reality of the living experience, where we can legislate what the accommodation should look like, but we can't legislate a culture change. And so again, that comes into a whole lot of work of how do we continue to talk about this, how do we continue to support mothers, and ultimately how do we protect mothers so that we can ease their way to accessing the rights that they have under this law. So to support this implementation, the USBC was funded by the Office on Women's Health to enhance the coordination and reach of effective messaging to mothers about the law. So we took the official federal resources that I mentioned earlier, the statutory language, the fact sheet, and the FAQ, and we pulled that all together to try to make the information more accessible. So we pulled those into a single user-friendly online resource. So the content is further supplemented with additional information from the Business Case for Breastfeeding Toolkit, as well as other official federal resources on related topics, trying to be as comprehensive as possible within the scope of the project. So we launched the content on our website about 10 days ago, so it's new, and if you haven't seen it, I highly encourage you to check it out. While the guide does not address many of the most common questions we receive from mothers, again, mothers are going to need guidance and your help on the state level. So in the process of crafting this guide, we recruited moms from across the target audience to serve as reviewers for our content. So in the end, we had 47 volunteers that were selected by race and ethnicity, education and reading level, English as a second language, age, and employment and geography. And they completed reviews of one or more sections. Since the content is very, very long, we broke the content up into smaller pieces for moms to review. Then we updated the content based on that feedback we received, and the guide went through additional clearance through the Office on Women's Health. The final approved content created this guide called What You Need to Know About the Break Time for Nursing Mothers Law. There are about 20 sections of the online guide covering everything from the basics of the law to preparing to go back to work. The contents highlighted on this slide are the areas that we anticipate are going to be most helpful to the public. So basics about the law, the intersection of state and federal laws, which we know can be very confusing, resources for working with employers, preparation, pump, and storage of milk, and additional resources and information. So to go into a bit more depth, The most common misunderstanding about the law is related to the undue hardship exemption. So the online guide is meant to clarify that all employers are required to comply with the law. So employers with fewer than 50 can apply for the undue hardship exemption in response to a complaint. So they can't do it proactively. They can only do it in response to a complaint that's come up, at which point they have to prove significant difficulty or expense in relation to the size, resources, or structure of their business. So even if an employer has fewer than 50 employees, they have to comply with the federal government, unless the federal government has issued them an exemption for that individual mother. I think this is a really important thing for all advocates to get clear about and to make sure that all written materials highlight this important distinction, especially since, as I mentioned earlier, so much of the media has been getting it wrong. So we find there's also some confusion about who is covered by the law. So the break time law only applies to non-exempt employees that are covered by the Fair Labor Standards Act, or FLSA. The online guide includes a flow chart and an explanation to help moms determine whether or not they are covered. We'd also just like to quickly note here that the Supporting Working Moms Act would expand the break time law to an additional 12 million workers, including teachers and administrative professionals. If you're not familiar with that effort, I encourage you again to look into that. So when both the federal and state governments address the same situation, the stronger law applies. So this means that in states where there are workplace breastfeeding laws that are stronger than the federal law, the state law overrules the break time for nursing mothers law in the places where it's stronger. We recognize that that's pretty difficult, but in the online guide we created a step-by-step guide so that a person, hopefully a state breastfeeding coalition or a state-level member of AMCHP, could be working to clarify exactly what the rights look like within that state. I'm very excited to announce that CDC has just provided funding for USBC to be able to do a formal analysis of this and come out with guidance that will be on our website that will share that information in one comprehensive place. But until that day, our online guide will help you get there. We've created this guide to address the top questions that we receive. The guide addresses a lot more than what I just highlighted briefly today. But I wanted to also let you know that we are in the process of completing a gap analysis, comparing the questions that we receive to the official guidance that's currently available. And we'll be presenting those findings of the gap analysis to the Department of Labor with an appeal that they provide additional guidance to the public. So we hope that you will promote and share this online guide. It's designed to serve as a resource for you and for employers and for families. The link, as you can see, is pretty quick and easy, just our website /workplace-law. We've also provided here a sample post if you're on Twitter. Be sure to share this with your social media outlets as well. So thank you very much for your time today, and I'm happy to field any questions at the end of the webinar or beyond.
Great. Thank you so much, Amelia. I'm now going to turn it over to Holly Dingman and Paula Urich with the Nebraska Department of Health and Human Services to discuss breastfeeding accommodations in their state.
Good afternoon. This is Paula Urich. I will begin our joint presentation today. And on behalf of the Nebraska Department of Health and Human Services, I'd like to thank AMCHP for the opportunity to present on Nebraska's Workplace Support Project. A little bit about who we are. I'm the Administrator for Lifespan Health Services Unit in Nebraska's Title V Maternal and Child Health Director, and Holly Dingman is the Nutrition Coordinator for the Nutrition and Activity for Health program. Though administratively housed in different public health units, Holly and I represent programs with a well-established history of collaboration in support of breastfeeding. As an example, both Title V and the Nutrition and Physical Activity programs were instrumental in establishing Nebraska's Breastfeeding Coalition. Our work together reflects our mutual interest in promoting state and national goals for increasing breastfeeding rates. The Surgeon General's report of 2011 and Nebraska's Title V Maternal Child Health Needs Assessment of 2010 both established the priorities for breastfeeding and breastfeeding support. The Partners in Health State Plan operationalized Nebraska's goals as we will sort of describe some of those activities in the rest of our presentation. At this point, I will hand over the phone to Holly Dingman.
Thanks, Paula, and good afternoon, everyone. I am going to briefly go over our breastfeeding goals here in Nebraska and look at our breastfeeding rates. We have, like all the other states, decent initiation of breastfeeding in Nebraska, around 80%. However, as our moms are returning to work, we can see that our exclusive rates of breastfeeding at 3 months are just under 50% and continue to drop to about 1 in 5 moms making the goal of 6 months of exclusive breastfeeding. And we know that support at work plays a role in these numbers. The timing of our collaborative workplace project was really well-timed with a survey that we conducted in 2010 around worksite wellness. It included 3 questions about worksite support and breastfeeding. The survey results revealed that only 1 in 4 businesses have a private and secure lactation room that was not a bathroom. 1 in 3 allow additional break time for expressing milk, and only 1 in 10 have a policy. And those were of 1,500 businesses across the state. This survey is being replicated currently, and we'll have some comparison numbers out this spring. So the stars aligned for this project in the fall of 2011 when the Women's Health Advisory Council developed a worksite wellness subcommittee that indicated that there was a need for increasing the visibility of breastfeeding and the FLSA as an opportunity for action. At the same time, we had released our Nebraska Physical Activity and Nutrition State Plan, which had a key strategy around increasing breastfeeding in the workplace, and the Nebraska Breastfeeding Coalition was operationalizing this state plan in their annual action plan. And like a lot of good projects, it goes down to who can do the work. We were blessed to have Tracy Delaney, who was a UNL from University of Nebraska-Lincoln Dietetic Internship Program, and also happened to be a nursing mom. She convened the group between the Breastfeeding Coalition, Department of Health, and the Women's Health Advisory Council to establish the Nebraska Breastfeeding Workplace Support Strategic Plan, which included 3 objectives. One around educating employers with some materials, hosting in-person return to work events, and launching a breastfeeding-friendly business. So Success 1 really was the partnership that came together through this work. We engaged 2 divisions within Department of Health and Human Services, in addition to the Women's Health Advisory Council, Breastfeeding Coalition, a local breastfeeding clinic called MilkWorks, WorkWell, which is a regional worksite wellness association, and a key partner was, and a new partner for us was the Nebraska Department of Labor. And we found that within the Department of Labor there was a Fair Labor Standard Act program manager who was key to this project. Success 2 was that we did host 2 in-person return to work events. The panel, each event was about a 90-minute event with a panel that included an attorney, a local attorney, Adam Prochaska, the executive director of MilkWorks, and Seacrest. She talked about what it takes to support a mom. What does a pump break look like, and communication strategies. We had human resource managers, 2 of them, from a large and small business, and we also included the mother's experience and had 3 mothers share their experiences. The Lincoln event was taped by a local health channel and happened to air for about 18 months. They initially intended to air it for 3 months, and it kept getting over 100 views a month, and so they ran it for 18 months, which we thought was a success. On the next slide you can see kind of a panorama of this is where the panel sat and where the attorney sat, and I just think it's great to see the room filled with business leaders and the bright lights of the camera and the pump sitting on the table. So the second objective that we worked on was really to distribute some consistent information to businesses on the law. Again, our Department of Labor partner was critical in helping us identify a list of businesses within industry types that had the greatest percentage of women of childbearing age. They came up with a list, with a business list of about just over 4,000 businesses. So we took that list and divided it into businesses with 50 or more employees, and they were mailed a complete large packet with a letter that was signed by both our Chief Medical Officer, Dr. Joanne Schaefer, and the Commissioner of Labor, Catherine Lang. It included a flyer on the law, a how-to guide with Nebraska businesses being highlighted, and a materials request form so we could hear back. We also thought it was really important to send information out to these businesses that had 30 to 50 employees, and so we did a half-sheet postcard that included just some basic law details and pointed them to the direction of some more resources. A key component in both of these was to identify a regional phone number for the Department of Labor, and we have a regional office out of Omaha, Nebraska. So if people had questions, they weren't calling some other state, but able to hear from someone, our own expert. And the next few slides just show the businesses that were highlighted. The state office building here in Lincoln. We had a health department in central part of the state, Grand Island. And then on the western side of the state, we've highlighted Box Butte General Hospital, and 2 businesses in Omaha, the Chamber of Commerce, and then the last one is the Extension Office. And each one looks a little bit different, but could give businesses an idea of what this means to provide a space. Department of Labor also was willing to put this information and house it on their website, and we've included a link there. If you're curious to see the materials that actually went out in the packet, you can see we've put all of that information, including the resource request, on that Department of Labor's webpage. Another success we had was to interact with the businesses and provide some direct technical assistance, and this predominantly came through the use of this resource request. We heard back from 130 businesses who wanted materials, whether that was a sign for their mother's room, a door hanger that could be flipped when in use, some motivational signs, or the business case for their nursing employees. We also received a number of phone calls and email inquiries, and there was a success that came out of Grand Island. A WIC mother was working at a fast food restaurant and utilizing WIC services. And the fast food restaurant was sending her up the street to the library for her pump breaks, and she reached out to the WIC office, and they helped get her connected with that regional office phone number. She called them. The Regional Department of Labor sent out a representative, conducted a site visit, helped create an in-house solution, a version of a pop-up pumping tent in the break room of the fast food establishment, and also helped that mom request and claim lost wages from her time going up to the library. And you can see we recognized her at one of the Breastfeeding Coalition meetings, and that's a link to her video. And the third objective of our strategic plan was to establish the Nebraska Breastfeeding Friendly Award. We launched that about a year ago. You can go online and see it's an online application. Not only do they have to meet the basic requirements of time and space under the FLSA, but there also needs to be a recognition of a supporting atmosphere, policy, whether that's formal or informal, and some communication to employees about their lactation support. Those that are completing the application must give some supportive documentation from an employee that has used or benefited from the workplace support. And each application is reviewed by the Breastfeeding Coalition leadership team. Recognized businesses receive a CLING certificate that's signed by the Women's Health Advisory Council chairperson, the Nebraska Breastfeeding Coalition director, and our chief medical officer. And to date, we have 16 businesses that have been recognized. Here's the contact information for Paula and I, and we're more than happy to answer any questions. And I'll turn it over to you, Megan.
Wonderful. Thank you so much, Holly and Paula. We'll now move into the question and answer portion of today's broadcast. Again, if you have any questions, you can use the chat feature on the lower left-hand side to submit those questions. So I'll go ahead and start off with Debbie. We've got a lot of different questions about IBCLCs. Who exactly is included in that? Some questions about if dietitians are included, and who can be reimbursed under New York State Medicaid. Would you mind expanding on that a little bit further?
Yes, I would go ahead and expand. The Basic Benefits Work Group, which Dr. Barbara Dennison was the lead on, she researched IBCLCs in New York State, and the proposal it was much broader than just what it ended up being. Medicaid chose, because it was concerned about getting this approved with CMS, went ahead and chose the definition that we currently have, which means that IBCLCs have to be licensed and currently registered in those 5 professions. So that basically means this is the more narrow definition than what was proposed, but this is what we went through and got approved. This is considered a first step by Medicaid. So questions such as the registered dietitian. The dietitian, which I'm one, I'm a certified dietitian nutritionist in the state of New York. I am not licensed, and so we're not considered part of the licensed group, as I just mentioned. So can registered dietitians provide services? Yes, they can, but Medicaid will not reimburse. Likewise, if someone is an IBCLC and such, if they're licensed as a master's medical or clinical social worker, they also can provide services, but Medicaid will not reimburse for that service. So basically, this is a first step for our state to set in motion that IBCLCs are service providers. They coupled it with being licensed and registered in New York State, and this was approved. But some of the other professionals that are out there working, including if Dr. Dennison had looked at CLCs in New York State. But at this time, the definition is what it is, and we're hoping in the future that this will be addressed again. So for anybody out there in New York that would like to, send a letter in and share their opinions about this and with the other professions, please do so. I hope that answers the question, or questions, I should say.
Great. Thank you so much, Debbie. And then Amelia, I see a few questions for you regarding protection for salaried women. Would you mind expanding on that a little bit?
Yeah, that's fine. As stated, the law does not cover salaried workers. The law covers hourly and overtime eligible workers. And so that is leaving out an extraordinary number of women, while it is protecting what we would imagine generally to be the most vulnerable workers. We still need to find the mechanism to scoop up the rest. So the Supporting Working Moms Act is proposed legislation that would do that. So again, that's why I direct you to information about that. You can find it on the Advocacy Headquarters section of the USDC website.
Okay, great. Thank you. And then we have a question about breastfeeding counseling groups have been provided by WIC in the past. How will these changes impact their funding? Not quite sure who that was directed to, but if someone would like to take a stab at that.
This is Paula Urich. The breastfeeding counseling that may have been referenced would be peer counseling, which is supported by USDA through its appropriation of WIC funds. So I don't think it would have any specific impact related to private insurance or Medicaid, since the funding stream is specific to the WIC appropriations through USDA.
This is Debbie in New York, and I agree with that. I worked with WIC for 17 years, and peer counseling is funded by USDA, and so the WIC clinics need to pair up with their community partners and work with their hospitals and other stakeholders in the community. But peer counselors can network with IBCLCs at hospitals and et cetera, but their coverage and the reimbursement, the funding for peer counselors comes out of the USDA funds that are given to the state agencies.
Great, thank you. And this question is directed toward both Amelia and Beverly from USBC. Can someone focus a bit on the lack of guidelines within lactation professions?
This is Beverly. I can address that. I'm not quite clear on the question, the lack of guidelines within the lactation profession. I'm not sure if they're talking about training or certification. However, just generally, all lactation care providers provide a significant level of support for breastfeeding mothers, whether it's peer counselors or those that function on a different level in terms of providing clinical care. Everyone can provide preventive care in some way. Not all are trained to provide specific clinical care, though. So within the lactation profession, there are many that come to the lactation profession from many different backgrounds and many levels of training. So until those there's more specific indications of how we will function within reimbursement frameworks, it's very difficult right now for all to come to the table and be reimbursed. I'm not sure if that actually answers the specific question. However, we are working towards those goals, that there will be a place for everyone and clearer guidelines from the insurers and payers as to how to reimburse all levels of lactation care. That's our goal for the future. But right now, insurers have they're specifically oriented to those who are licensed, which is why the state of New York is functioning within their purview of those licensed providers who are also IBCLCs. However, as we move forward, hopefully some of those parameters and limitations will change.
Great, thank you. And it looks like it is about 3 o'clock now, so out of respect for everyone's busy schedules, we're going to go ahead and wrap up the call today. I know there's still some questions that were left unanswered, so what I will try to do is relay those to the appropriate presenter and post an FAQ document along with the recording of today's webinar and slides on our website so everyone can get their questions answered. And again, I'd like to thank our presenters, and I'd also like to thank our attendees for being on the call today. Finally, I would like to thank the Kellogg Foundation for your support of this work. We hope you found this to be value added for your work and that you'll share this information with your colleagues. And again, this webinar was recorded, and the link to the recording and speaker slides will be posted on the AMCHP website within the next week. I'd like to remind everyone to please complete a brief evaluation that will pop up on your screen after this webinar. AMCHP has other resources on this and other topics related to the Affordable Care Act on our website, amchp.org. And again, thank you so much, everyone, for joining, and have a great rest of your day. Goodbye.